Thank you. Thank you, panelists. You're making my job as a moderator very easy by sticking with the time frames. I appreciate that. We're going to move into the discussion part of the panel now. And we've taken some questions from actual inquiries that have come into the Autism Society. And when we ask these questions, they're going to be directed to one of the individual panelists. But please feel free to comment or ask other questions of each other. Mix it up if you want. But the first question goes to Dr. Friedlander. And this question came in and it states, I live in a state where we just passed insurance legislation and it does not cover my child with autism. How am I going to pay for her complex care? So with that said, payment for services is a constant issue in autism. As we are talking about the future today, I think we'd agree that down the road, the solution lies with Medicaid, education, and private insurance working together. What needs to happen to make this a reality?
There's no easy answer here. I think that this is a challenge that many parents are facing. It's a very difficult situation. You know, if there's a one-liner kind of a response for a parent of a child with a condition on the autism spectrum, it is become that child's advocate, become that child's champion. There are so many areas in which advocacy or lobbying for support is going to have an impact. And it's at every level. It's with your employer, speaking to the human resources department, making sure that as a corporation they're aware of the challenges that you're facing and consider adding autism coverage if they don't already have it. It's working with your school district. And even in interacting with the school district, there is sometimes a need to involve an education law center or some local parents-involved network or whatever the local equivalent is, so that you know how to communicate most effectively with the school district so that special services, if appropriate, can be designed, an individualized education plan can be developed, and at least that component can be taken care of. For many parents, the first thing they hear from any of these attempts is no. But persistence and advocacy is what's needed. There are other levels at which this can occur. Speaking to the local county Department of Mental Health, Mental Retardation, if appropriate, or the State Department of Developmental Disability, it's amazing to me how effective one voice can be. Before I took my job at Aetna, actually 3 jobs ago, I was working for the school districts in one of our suburban counties around Philadelphia. And one parent can change policy for a whole school district just through his or her advocacy, by being persistent, by coming in armed with the knowledge of what are the special education regulations, what are the entitlements, what does federal law say on this, what does state law say on a particular issue. Just having that knowledge, just continuing to be persistent is going to result in a whole lot of movement for that child. From the health plan perspective, there are many roadblocks that individuals face in getting coverage for health-based services that their children need. In many situations, it's related, just as it is with the education department or with some of the other publicly funded departments, it's based on having a sound knowledge of your rights, having a sound knowledge of how the system works. It requires a tremendous amount of research. I've been with Aetna 7.5 years, and I'm still learning how the business works. And as a consumer, and when I try and get services for my children, same issue. It's constantly a challenge. It requires tremendous research, but the persistence pays off. Using your appeals system, understanding that possibly the reason that there wasn't coverage is because the provider miscoded the claim or submitted the claim with an error on it. All of these claims are adjudicated automatically by computer systems. If there's one field that's missing, In many situations, the code is, the claim is categorized as miscoded and is sent back to the provider. And if the provider doesn't understand what they needed to do, they just pass it on to to the family and say, "Hey, your insurance didn't pay. It's up to you now." But arming yourself with that knowledge, continuing to push, continuing to be persistent makes sense. The scenario that was described was a state mandate that didn't provide coverage. Well, states are very responsive to testimony and the efforts of individual parents. Working with your local representative, going to the state capitol, testifying in front of committees, provides very compelling support for mandates, for coverages, for expansion of coverages, and it is truly amazing how wonderful this country is at responding to individuals. You can hear from my accent that I wasn't born here, but I'm an American citizen by choice, and I'm amazed at how effectively an individual voice can lead to change. We've seen it with the Autism Society of America, but it happens at a local level on a daily basis. But the bottom line is be an advocate for your child with the health plan, with the state, with the school district. It's going to require all of that coordination, all of that effort to have an impact.